One of the areas that we've seen a real increase in interest in has been looking at arms. And it sometimes is the weight loss patient, somebody who's lost 50, 75, maybe 100 pounds. And that's significant. There's really loose skin just hanging down. That's a surgical procedure, no question. We're going to have to remove that extra skin. There's going to be a seam that runs inside the arm. And traditionally, when someone came in and maybe just had a little problem there with the arms, we had to really evaluate whether or not they wanted to have that scar, because that was the trade-off, was having the scar. Today we have some other options, and one is BodyTite. So we can sometimes, again, this is for a more moderate case, but we're finding someone that's maybe just early on in this process, not because of a lot of weight loss, because of genetics. They just hate their arms. They don't want to wear certain things because they're self-conscious. We can at least evaluate them as a possible candidate to do some lipo. Of course, that makes things looser, and then the key is being able to tighten that skin up. Now, we try to warn patients that if that doesn't work, they need to be willing to accept the fact that ultimately, and maybe 10 years down the road, skin gets more lax. The only real treatment would be to remove the skin and have the scar. But the cool thing is, we've got options now that we didn't even have 10 years ago. So in some cases, it may be a more minimal procedure and still get a really nice improvement.